My name is Vitus Silago. By profession, I am laboratory scientist, and currently I work as assistant research fellow in the Department of Microbiology and Immunology of the Catholic University of Health and Allied Sciences, located at Bugando Medical Center in Mwanza, Tanzania. By experience, I do numbers of research, and this research based on the microbiological or epidemiological investigation of infectious diseases, focusing on antimicrobial resistance. And by the simple meaning, antimicrobial resistance, a simple definition, antimicrobial resistance is defined as the organism responsible for causing infection. They were once susceptible to certain antimicrobial, but now they become resistant to particular antimicrobial. So, for example, if ciprofloxacin was used to treat urinary tract infection due to bacterial infection, now ciprofloxacin is not effective in treating urinary tract infection due to bacterial infection, because bacteria causing urinary tract infection have developed a mechanism to resist the activity of ciprofloxacin. So this is a simple example of how or what antimicrobial resistance means. And this antimicrobial resistance can happen due to different numbers. We specifically call them drivers. There are different drivers causing antimicrobial resistance. And this, the major cause of antimicrobial resistance is inappropriate use of antimicrobials. To be specific, inappropriate use of antibiotics. For example, an individual or a person is suffering from flu or cold or cough, and this individual, this person is using antibiotics for treatment of cough. This is inappropriate use of antibiotic, because cough or flu are not treated by the use of antibiotics. And another is when a person is using antibiotics and this person does not complete the course of antibiotic. And this happens when someone is using antibiotics, and then after feeling relieved, feeling that the symptoms are vanishing, then the individual stops to use antibiotics, thinking that he or she is completely cured. But in reality, the individual is not cured. And then this drives the organism causing such infection to develop resistance, because they have get incomplete course of antibiotic. And this inappropriate use of antimicrobial happens commonly in healthcare facilities, in the hospitals, when antimicrobial are used unnecessary, and it also happens in the community when people goes to the community farmers, instead of buying a complete course of certain antibiotic, they buy half course or quarter course, or sometimes even 2 tubs of certain antibiotics. And this together drive the emergence and the spreading of bacteria resistant to antibiotics. And the impact of antimicrobial resistance is increased morbidity and mortality. In a simple language, increase the number of deaths, because antimicrobial are no longer effective in treating bacterial infections. Therefore, we lack appropriate options for effective treatment of infectious diseases. So this is associated with the increasing number of death, especially in the hospitals. And another negative impact of antimicrobial is we lack prophylactic coverage. Prophylaxis is when we use antibiotics to prevent the future infections. So if the antibiotics are not effective, then this prophylaxis coverage is lost. Another impact is reduced productivity, because individuals or people use their productive time for seeking medical treatment, using their productive time for finding what the effective medications for their treatment. And another is because now antimicrobial for treatment, then individuals or in the hospital, we do trying of finding what antibiotic is effective for treatment, then resulting to prolonged hospitalization. Instead of an individual to stay for a long time in the hospital, then an individual stays for longer time because of antimicrobial resistance. And the another one is increased healthcare service cost. If we compare, for example, an organism was supposed to be treated, or an individual was supposed to be treated by the use of say, ampicillin or nitrofluntoin. These antibiotics are very, very cheap, 3,000 or 4,000. But if the resistance is there, then the individual should be treated with highly costly antibiotics. For example, meropenem. Here we talk about 6 to 800,000 Tanzanian shillings. So this increases the healthcare services cost. So this all the negative impact of antimicrobial resistance. And together, healthcare workers or expertise and the community, we can fight to contain the crisis of antimicrobial resistance. What the community can do? The community can do is this. First, people should ensure that they complete the full course of prescribed dose, no matter the symptoms and the signs have diminished or disappear completely. But if the dose is for 3 or 5 days, then people should complete the dose to 3 or 5 days. And the second, people should know that they are supposed to purchase, because individual access antimicrobials from community farmers. So they have to be aware that they are supposed to buy a complete course and not have a course, so as to fight this the crisis of antimicrobial resistance. As well as the government should implement the laws and the regulations of selling and the purchasing of antimicrobials in the community pharmacies. That is what we can do to the community. And what we can do in healthcare facilities is we healthcare workers, prescribers, dispensers, to make sure that we follow what is known as antimicrobial stewardship programs. that the individual is prescribed antimicrobials with evidence, laboratory evidence, that the individual is suffering from, say, certain disease, and the organism is isolated, and the organism is sensitive to a particular organisms, which that a particular antibiotic, and those antibiotics should be prescribed or dispensed to the individuals. So, to my opinion, it is important to have campaigns, and these campaigns should focus on the community. So, why focusing on the community? Focusing on the community because the community is not aware of antimicrobial resistance. So first, to create awareness of antimicrobial resistance to the community, so as we healthcare workers, together with the community, we can fight the crisis of AMR or antimicrobial resistance, specifically antibiotic resistance. Why? If the community have awareness of what is antimicrobial resistance or what is antibiotic resistance, it will be easy to be engaged in the fight of antimicrobial resistance for making sure that whenever they have developed infections, they are supposed to seek medical services, to go to the hospital for treatment, not to the pharmacy for purchasing antibiotics. First, go to the hospital. The hospital, they will be diagnosed. After diagnosis, clinicians or medical doctors will prescribe appropriate antimicrobials, appropriate antibiotics, and then they can go to the pharmacy to purchase or to buy these antibiotics while they have already known their diseases and what is the appropriate antibiotic to treat their diseases. So this will ensure that effective and necessary and appropriate use of antimicrobials, notably antibiotics, is performed or taking place to the community level. As I said before, unnecessary and inappropriate use of antibiotics is the key driver of antibiotic resistance. So, at QS, we started a Daladala campaign under SNAP-AMR, and this Daladala campaign is to ensure that we reach the community. We give them the knowledge, the awareness of antimicrobial resistance. So through this Daladala campaign, posters and banners have been and stickers supplied to the Daladala, to the taxi, so as whenever people use public transport, they see the message on antimicrobial resistance, the message on antibiotic resistance. So they get to know what is it and what they are supposed to do. So as together we can fight antimicrobial resistance. Together we can reduce the number of deaths due to antimicrobial resistance. Together we can reduce the health care cost due to antimicrobial resistance. So if you are at town in Mwanza city, you can see Daladala from town to Bugarika passing through Bugando with stickers telling the community what is the antimicrobial resistance. So this is how we do to reach the community, to create awareness to the community so as we can fight antimicrobial resistance.